Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM OET Institutes. Again, here for you to teach you about different things. And today I'm going to record this very small video. But before that, if you have not subscribed our channel, do subscribe for all the updates about how to best achieve OET. And that is the main thing I want to tell today as well. That when it comes to reading part A, I know guys that everybody is telling you start from question number 8, start from question number 8. I understand everybody is telling you this, but please understand, start from question number 1. Please start from question number 1. If you will start from question number 8, you will not be able to manage time. I understand everybody is telling you go from question number 8. You also believe question number 8, if I will start from question number 8, then I will do question number 9, then I will do question number 10th in the reading part A. Then in the end, I can easily figure out that 1 to 7 are in which paragraph. But guys, you are missing the logic over here. Please understand my thing. Always start from question number 1 to 7. Why? Suppose if I start, I will give you an example. This is the reading of the day that we are doing today. So again, my job is to tell you how to do it rather than we don't know who prepared the question paper, but anyhow, it's from the most probably from the original authentic site. But again, Dr. BKM does not create question paper. We tell you how to do it. Suppose if I start from this question number 7th or 8th, whatever, how many patients with sickle cell disease has malaria in 2001? So then I will start it from here. Suppose 2001, 2001, 2001, 2001. Oh, no, 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 not given. Or 2001, 2001. That means I am starting from the A paragraph. And then I get to know, oh, 2001 is over here. Then I do question number 8. About what writers were unable to provide evidence statistically. Then you again go to this. Then you don't understand this question. Obviously, this is a tough question because statistics means numbers. Numbers means numerical percentage. So statistics are given over here as well as statistics are given over here. Anything that is given in the number form are statistics. And this is also statistics. But again, now again, you will suppose this question, what writers were unable to uh, provide evidence? Evidence means proof. That means they were unable to prove. So I think it should be in the result part because results will tell us what was proved and what was not proved, according to me. And statistically word is also given, prove word is also given by chance. But please understand your and my method. So Dr. BKM's method, suppose in question number 8, if I try to find this word evidence statistically, I will start from here. Again, A, B, then I will C, and that too in rush. Maybe I will find it, maybe I will not. Then I will come to D. So this is not the right way of doing OET reading. Now, please understand what I want you to do in reading part A. If you don't want to read the questions, don't read questions, but start it from the paper itself. Notice the main words. What is sickle cell anemia? Gene HVS 1940, 1.2 million people. Sickle cell disease recent. Sickle cell trait. Sickle cell gene is especially prevalent in Africa. In areas sickle gene is common. For parents, just one line. Most of the times one line and any numbers. For parents who carry sickle cell, 50% chances immune to malaria, 25% child will have neither sickle cell anemia nor the trait. Then you go to part B, it is talking about prevalence of the disease. Part C is talking about a study that was done in Kenya. Then part D is telling about ABCD in the final. It is not A1, A2 in the final exam, A, B, C, D. So D is telling about the results of the studies. Now your mind is projecting reading part A that in A, introduction of sickle cell anemia, B, prevalence of sickle cell anemia compared with malaria, and that is given in percentage. And over here, years are given. In the first paragraph, majorly it was about carrier and all that stuff introduction. C part, it is about an experiment. D part, it is about the results of the experiment. Now you go to question number 1. Data analyzing and outcomes. Outcomes means results. D. Now it will become a cherry cake walk. Please understand this method. Why to start from question number 8? Rather just understand in which paragraph what is given. Now this thinking, Suppose if I am doing question number 8, unable to prove evidence. So prove anything, whether proved or not, most probably would be given in the results, because after the experiment results will be there, that will prove something is wrong or right. Again, I can go to D paragraph. Suppose if I do question number 9, in which century HBS gene HBS gene was given in the first A. So if now I have to find out this question, I just will go fast. We'll see HBS 1940. So maybe 20th century, because 1940 means 20th century. So begin in the HBS gene. So means I know it is given in A. That is saving my time. If I do not follow the strategy, if I start from question number 8, I am always going from A, B, C, D. Suppose if I tell you any other question, let me take any, I'm taking random question. What is the total number of patients who had malaria in 2003? Most probably B, because years were given. Most probably B. What percentage of population carries at least one HBS gene? Most probably A. I'm not sure, but most probably A. Carrying this gene has an advantage due to conferred dash, not sure. Data support the strong impression of with age, interaction with age cannot be proved. Again, data and age, something word is given. Most probably it should be in D because it cannot be proved. So with age, C, D. I did not see first. I'm telling you that you would be able to guess that in which paragraph it is given. If in one question you will save 5 seconds, in 20 question you will save 100 seconds. In exam which is of 15 minutes, if you can save 100 seconds, that means 1 minute and 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 around 20 seconds. So it's 1 minute and 40 seconds. That means almost more than 1.5 minutes. In 15-minute exam, you will be saving 1.5 minutes, more than 1.5 minutes. So your speed will improve. Reading part A, oh sir, I can do it, but I am unable to manage time. Buddy, everybody can do this part. Everybody can do this. What's the big deal in reading part A? The main problem is time saving only. And as soon as you start from question number 8 and you do not understand this procedure, that first 7 questions are given to make you understand that in the part A, introduction, part B, prevalence of malaria and sickle cell anemia, part C, experiment in Kenya, part D, results are given. So now you understand in which paragraph what is given. Again, let me exemplify you more. Question number 19. In some reason, as much as dash, people carry at least one sickle hemoglobin gene, in which the dash we were reading maybe in the first paragraph that 50% of the population at least one sickle cell gene. So most probably the chance of their child, this one 50%, so half 50%, whatever it is given. So I'm not going into the depth, I'm telling you the method. So suppose if I have to do question number 20th, according to me most probably it is over here, that at least one gene, so it should be given over here, child will have at least one gene. So now I will, and now the doing methods. So first is to skim and scan, that is what saves time. So if you start from question number 8, you always start from A, B, C, D. You always start from A, B, C, D, and that is what wastes your time. I know everybody is telling you start from question number 8. Please don't. Please understand. Again, we have been teaching since last 11 years, being the oldest and the foremost institute of OET Institute, having 11 years of experience. And, you know, again, I'm telling you again and again, I know it's very hard to believe when everybody is saying so, but this video I especially wanted to create so that everybody can understand. Even my own students, sometimes I ask them, what is the strategy? Whenever they ask me, sir, I am unable to manage time, I ask, so which question are you starting from? Sir, I'm starting from question number 8. Buddy, I'm telling you again and again, start from question number 1. That is how people are passing. Please understand, don't ignore. And if I now say, in some reason, as much as dash of people carry at least one sickle cell hemoglobin gene. In region, it can also be in the D part also. If region word is given, Kenya can also be involved. But again, I want to first go in part A. If region word by chance, see now again if I do not use that strategy, then I am checking D, I am checking C. But region word most probably should be in A, most probably. according to my first intuition. I just have to find region word if I can find Africa. And then any other region is not given. And then I was saying maybe in this. So I have the trade gene, malaria, or it can be in the Kenya part. So it can maximum be in A or C. So this is like a hard question for me, but I have to check out the keywords again because I'm not doing reading in sequence. That's why it's happening. In which the dash cells are sickle or dash shaped. Okay, sickle or dash shape will give me. Now I have to read all the keywords. Dash shaped. So shaped word, if it is given other than sickle, any other shape, sickle shaped can also be the answer. But I need to find the shaped word. It's not given over here. Again, I'm going in the wrong direction. So I will go to A option only. I hope it should be given in A only. So it takes time, obviously. But again, I'm unable to find the word shape like a crescent. Thank God. So at least one of my guess was right. It is given in A. So now what did I do? Again, I wasted my time. I started from D, then went to C because I was anxious because I'm recording this reading and I have not done this reading. But again, my intuition was it should be in A. Then you notice the maximum keywords. So then I noticed crescent. Now it should not be that difficult for me as I just have to name the reason. Sickle cell anemia is the most common form. Is sickle cell is a serious disorder. Blood makes this. The red bloods are shaped, and they are talking about maybe Africa. I think Africa is the only region that is given. I couldn't find any region Africa in the areas of Africa. Yeah, prevalent. Now my keywords are there, and any shape is given. No, shape is this one, crescent. So these two are given in different. I hope my answer is right. I will cross check from you so that uh, we can discuss about this thing. Guys, answer crescent and Africa. Guys, answer please. 19th and 20th. If you can help me.
Sir, 20th is crescent, but 19th is
Some reason
40%.
as much as, oh sorry, in some reason as much as dash of the people carry at least one dash of the people, sorry,
Yes,
dash
sir, it is given in the A,
a
40%.
of word. Again, preposition is my word, so I did not read the question well, but yeah, I wanted to figure out where it is. That was the concern. But yeah, never miss out the word of. Now again, preposition strategy and shaped word. Shape word is given over here and of word is given over here. So that is as much as. All the keywords will be given. So OET part A is not about intelligence. Oh, I have to change. At least 16 to 17 questions will be exactly the same preposition of, will be the same things as much as. Now let's check the question. Let's check the question 20th. As much as of, only 40% can fit in. So the greatness is not, oh, I can figure out the answer. Everybody can figure out the answer. This A part of reading is to test how to do it quickly. And how to do it quickly, I'm telling you. Even if you don't want to start from question number one, start from the paragraph. That in paragraph A, treatment is being discussed. In this kind of reading, in this reading, in A, they were talking about introduction. In B, they were talking about malaria and sickle cell. In third, they were talking about an experiment for them. So you try. If there is any other topic, suppose the topic would have been of diabetes. So you say A, this is given. B, investigations are given. C, experiment is given. D, complications are given. So try to figure out what paragraph is saying and then try to figure out your question as well. What kind of a question? Like in this question was about proving. Proving means result. In which century should be in the introduction part. In which particular area a specific uh, was against clinical malaria. Clinical malaria, either it would be given, it can be given in C because they were talking about Kenya. It most probably would be given on A or B, but at least D I will not search because D paragraph is about conclusions. Still, I am saving time. What is the total number of patients who had malaria in 2003? Again, I know B. What percentage of population carries at least one HBS gene? Most probably A. Most probably A because that was given at least one population or it was given in the last A or D. So I save time. So first of all, what percent? At least one HBS gene. So rather than checking out whole, I will straight away go to A and will say at least one HBS gene. At least one HBS gene. It's given in A only or somewhere else? At least, or it's given in D. A, it
Sir,
should
it's in A only.
it should be in the A. At least inherits a normal this. At least one HBS gene. Mm-mm.
Sir, post parent.
See, even then it is taking time when I know it is given in A. And you guys are trying to find from question number 8, A, B, C, D without any logic. So then you find, and then you go precisely at it, try, but still at least one, it's very hard to find. Yeah, at least one HPSC. Now I know where it, now read the question. Skimming and scanning is the first thing they want. Now read the question and try to find preposition or something. Then you say, which question was it? Which we were doing? Okay. Which percentage of population carries? Which percentage of population and percentage? So I will say that is given in Africa in some region 40%. So two answers are 40%, I guess. Or this is the same question I am doing. No, two answers are 40%. There are two answers, 40%.
Yes, sir.
Yes,
Yes,
sir.
sir.
Yes, sir.
So this is
Yes,
again
sir.
the school. Thank you very much.
Yes,
So please, guys, do you understand the logic? Even
yes,
after
sir.
to the best institute, if you're not following the strategy, what is the benefit? Even if people who are watching me on YouTube, if you're not following this strategy, what is the benefit? Our class is not like just another YouTube video. You're listening to the best place of the world when it comes to OET, and I'm not saying it with arrogance. I'm just saying with experience. So please understand, go one by one. Don't go eighth question, directly eighth question. Then you will read A, B, C, D. It's like, again, I gave the example. It's like, suppose if your institute is on second floor, you are doing your reading module. You're going to ground floor, then we'll come back and we'll do listening. Then you will say, again, I am going down. Then I will come back, then I will do speaking. Then you will go down, then you will come back, and then you will do writing. So you're wasting your time in stairs. Rather, you should have climbed up the stairs once and should have done reading, listening, writing, speaking. In the same way, follow the pattern once, A, B, C, D, which paragraph is saying what, you save your time. You don't climb the stairs again. That is the main and the most important thing. And reading part A, skimming and scanning strategy is very important, because if you can secure your 17 to 18 marks in reading part A, then to you will 100% pass. Overall, you need 30 to 32 marks. So 17 to 18 marks means more than 60% of your marks in OET reading to pass. So please don't miss out on this strategy. Again, it's for your benefit. If you will follow it, you will see the difference. Again, saving 5 seconds one question, it will save 10 seconds. But still, I'm saying saving 5 seconds even is a big deal per question. 100 seconds. If you will save 10 seconds, 200 seconds, 3 minutes, you will have more as compared to other average student who is starting from question number 8. Thank you very much. Listening to it, but more importantly, if you will follow it, then obviously I promise you, deep down your heart, when you would be doing your exam, final exam, and when you will finish your exam in 14 minutes, you will be saying me thank you from deep inside. Thank you very much for listening to it. Subscribe, follow if you like it. Otherwise, that's fine. Thank you.